So as promised, we were going to talk about the silhouette lift. Maybe we should start with really what is a silhouette lift?
Silhouette lift really has a relatively long history in that several years ago, over 10 years ago, it was realized that you can create suture material that have hooks on them that you can put under the skin through a very small opening and pull up the skin that has already dropped, which is essentially a facelift. And over the time, this hook has improved, and right now the latest is the silhouette lift, which is a thread with certain number of cones on it that we place through a very small incision, lift up the lower face and the neck, and the scars are placed in the hairline so you cannot see them. And the whole procedure can be done under local anesthesia with minimal disability, so the patients come in, have the procedure, go home, and there is a certain amount of bruising and swelling that will resolve over the next few days, and most of the patients can return to work pretty soon afterwards.
Interesting. Now you talk about hooks. When you mention the word hooks, I'm sure a lot of patients instantly cringe, but you're really talking about really small cones that act as reinforcement to be able to catch the skin.
They are the anchor part of the skin, under the skin, and pull it up, and then you secure it to the scalp, which is firm and can keep it up there. They're not, okay. The new ones are not hooks. It started with hooks, but they're not hooks. And you don't feel these cones under the skin, and over time they get absorbed.
Oh, interesting. So really what's happening is the hooks are preparing the suture line, but once they dissolve, does the suture line stay, or if the whole rig actually dissolves?
Because the whole thing fibroses in, you don't need the hooks. In fact, over time, one can go back, and because of the fibrosis, can retighten the hooks and lift up even further. So that's another exciting aspect of this procedure, which is minimally invasive. And the other fact is that this fills a gap between patients who do not want a formal facelift with the scarring and the cutting and its own complications, and at the other end, the non-invasive tightening of the skin with various machines that really don't work very well. So this really fills up that gap, that through a minimal invasion, minimal scars, one can achieve a great deal of results that can last for quite a long time.
Now you had mentioned